Welcome to Brampton Focus. Well, the topic of fluoride has come up again in discussion. And with every discussion, there's always two sides. So let's just dive in. My name is Michael Charbon. Next on Brampton Focus, we meet a renowned fluoride specialist, a doctor all the way from India. That's Dr. Sushila, who's discussing her point of view that we should not be adding fluoride to our water. Then we're going to meet Dr. Eileen Davila, who is the medical officer of health for the region of Peel, who supports the position of both provincial and federal governments of adding fluoride to the drinking water of Canadians. That's next on Brampton Focus. Welcome back to Brampton Focus. Our topic today is about fluoridation of water. So let's just get you up to speed. You know, the provincial government here passed mandatory legislation that said fluoridation should continue. The region of Peel, all three mayors, Caledon, Mississauga, and Brampton, are fluoridating their water. The municipality spends here in the region of Peel some $450,000 a year to put about 460,000 kilograms of fluoride in our water. There has been a movement, and we at Brampton Focus have done two previous shows on this, talking about fluoride in water is not good for you. So, as this discussion continues, and some people are starting to object of having fluoride added in their water, a group has brought a very esteemed colleague here to do a talk and to start talking about the issue of fluoridating water. They brought Dr. A.K. Sushila is here. She's a world-renowned expert on fluoridation, toxicity, fluorosis expert. She's got a PhD. She has a fellowship of the Academy of Science and a fellowship of the Academy of Medical Science. This is a very well-educated, esteemed lady, respected around the world, spoke to the British government for hours, and is here to talk to us about fluoridation of water. Dr. Sushila, thank you so much for joining us at Brampton Focus.
Thank you.
The Ontario Health Minister, Dr. Eric Hoskins, stated and was part of the board for the provincial mandatory legislation of adding fluoridation to our water. You're purporting that we don't need fluoridation and that it, after your study and your work, it's actually a negative effect. Tell us where your positioning is and where we may be missing the point here.
Yes. In fact, what is happening here in the government circles, people do not basically understand the concepts have changed since 1940, and fluoride is not a element which the body requires. It's a toxin, it's a poisonous substances, and it does so much damage to the body. Various tissues, is a neurotoxin, is a hormone disruptor, and an enzyme inhibitor. There's no one chemical which can do so much of damage to the body, and we are adding into the water, toothpaste and other things, and pumping into the people's body, and people are sick in this country, which you are not aware, because there is no other test by which they can detect the circulating levels of fluoride in the body. That is the indicator which you should be knowing, because urinary fluoride testing, blood fluoride testing are most essential in every hospital which you don't have it.
Now, I had the opportunity to discuss a little bit before we started our interview because I wanted to ask this question, and I wanted to ask it in a respectful way. Your education, your credentials stand by themselves. There's no question of that. But the question begs, why do we need to have a doctor from another country come to Canada and tell us that what we're doing is wrong when it's legislated in our province? I mean, the American Dental Association has been supporting this since 1940. Our mayors are doing, all these people wouldn't do this to endanger our people. Why have we missed the boat?
You know, the reality is, since 1940, the concept started in 1940 saying fluoride is good for teeth. Now, 75 years have passed. Science is not static. In every part of the world, people have been working on this, bringing out information, except for United States and Canada, where the scientists are not given grants and they're not able to do research. Even if they do research, The results are not
So
published.
it's a very salient point, Dr. Sushila. Are you saying then that we do not have scientists and dedicated people here in Canada that are doing research specifically on fluoridation? Is this what you're saying?
Precisely. And the policymakers are depending upon the 75-year-old concept, and they are going along the direction of the wind. They don't want to oppose. They want to have a comfortable life during the term of their tenure. So why should they mess up the issue and make their life miserable?
So large pharma is putting fluoride in toothpaste. You have oral rinse. You have there are certain medical organizations. I mean, the Ontario the Ontario Dental Association also supports the fluoridation of water. So many people are on this. Why are we in this quandary?
Reason is, in most of the developing countries like India, China, African nation, Thailand, Turkey, we have excessive fluoride coming into the drinking water from the Earth's crust. Because we draw the water from the Earth's crust.
So you're removing fluoride from the water.
We are removing fluoride.
Yes.
We are defluoridating the water.
Right.
And that is the reason why the government supports research. I may also tell you one very interesting information. 33 years ago, the Canadian government supported my research. And in Ottawa, you have an International Development Research Center, IDRC Canada. They supported my research on a project, multi-institutional project, and the project's title was Fluorosis India. And they could not support here. They came to India because we have a wealth of patients, and they wanted to know what is the information which will emerge.
Well, you probably had extreme patients, right? You had extreme examples of fluoridation poisoning for all intents and purposes.
Yeah, we have all grades.
Yes.
So the research which came out of the IDRC research is really speaking brought me to this country.
But the level of fluoridation in our water, you're talking about fluoridation from natural sources through the Earth's crust.
Yeah.
So you have the ability in India to study extreme cases of tremendous infusion in the body to others. When we're talking about fluoridation of water here in Peel region, North America, it's 0.0 whatever. It's very, very small, right?
Now, what you really have to understand is the fluoride is not coming from only the water. Water is fluoridated, there's some portion come from there. Toothpaste is fluoridated, it comes from there. And the food, most of the preservatives which are used for preserving food, tuna fish, fruit juices, whatever is sold in the supermarket, they all you add preservative. One of the preservative is fluoride. Why? It kills the bacteria.
Right.
The same concept which is for added to toothpaste, sodium fluoride is a bacteria. It kills the bacteria, and therefore the food preserved which are bought from people are so used to eat the
So I've learned three things. Here. Number one, we don't have dedicated scientists in Canada who are doing research on fluoridation of water. Number two, the fluoridation of water is minuscule but has a more accumulative effect.
Exactly.
And we haven't done any research. There was no specific test for your urine to find out how much fluoride you have in your water. And number three, we understand that there are large pharma, etc., who will behind the propagation of this supposed myth, as some would say.
That's right.
How would you sum up the position and where we should be here in Canada as we move forward?
What I would really like to mention, the policymakers should know the fluoride is not good for health. That is number one. Number two, they should also introduce compulsory education of fluoride poisoning as a public health issue in medical schools and dental schools, and they should encourage Canadian scientists to continue research in this area in the benefit of the people of this country, so that outsiders don't have to come and advise you.
Dr. A.K. Sushila, a very interesting discussion. We really appreciate you coming here. Thank you for taking the time. And as I said, very interesting when you look at all the credentials that this esteemed doctor who has spoke to the folks in Britain, to their government and to their ministers. So something to consider as we continue our program on fluoridation. My name is Michael Charbon. You're watching Brampton Focus. We'll be back with lots more right after this. Welcome back to Brampton Focus. You know, the topic of fluoride in your water, as you saw from our first guest, Dr. Sushila, is something that a lot of people have passion about. Lisa Ciancino, we've had many shows that we've done on this. But when you want to find out what the region of Peel is all about, who do you have to talk to? Well, you talk to the medical officer of health for the region of Peel, and that's who we have with us here today. Dr. Irene Davila is here with us. Dr. Davila, thank you for being here.
Thank you, Michael.
Last year, the region of Peel spent about $450,000 for 460,000 kilograms of fluoride to be added to our water. Dr. Sushila and advocate groups like Lisa Ciancino believe that it is important to not add fluoride to the water. We also have Calgary, Quebec City, Waterloo, Windsor, St. John's, who also believe that it's not necessary. The alternative position is, and this is quantified, if you wish, by the federal government and by the provincial government, that it is important to maintain dental oral hygiene, and it is good for the public. We now have to find out where we go from here. We're not going to do it, but we want to find out from you. You're the boss. You're in charge of our health. You're a doctor. Where do you stand on this, and where are we going, or where are some of those people going wrong with their concept that adding fluoride is bad for us?
So, well, first let's start off, as with any good physician, you have to start off with a diagnosis.
Right.
And the situation here in Peel region, like many other places throughout North America, is such that cavities or dental caries is one of the most prevalent chronic diseases amongst children, adults, people of all ages. And it is significant. It poses a significant health burden, or places a significant health burden on these residents, whether they're children, adults, or older people. So what we advocate at Peel Public Health is a comprehensive approach towards improving oral health. And one element of that comprehensive approach is community water fluoridation.
So two of the rebuttals to that is that fluoride applied to dental process is done on a topical standpoint with trays where you put it in. And secondarily, Dr. Sushila points to some statistics that identify that fluoride in a certain concentration can be detrimental to the advancement of a fetus.
So let's talk about your first point first. The notion of actually going to seek dental treatment through dental providers, dentists, and what have you. So that's absolutely one of the other elements that's important in a comprehensive approach to oral health, going to a dentist. Unfortunately, the reality is, for many people in Peel, access to dental care is just not within their reach. Dental care is not actually covered by OHIP at this point, and that's the reality. So what we're trying to do is make sure that we're providing this comprehensive approach.
But
for
some
those
people,
who can
like
go
Lisa
to see the
Ciancino,
dentist,
state
absolutely.
that it should be their option to decide if they wish to fluoridate.
Well, again, we have a number of people who have no access to dental care whatsoever. This is actually proven, right, through the quality evidence. When you look at the research that's out there, over 70 years of research, over 70 years of practice, actually demonstrate that community water fluoridation, as it's practiced here in Peel, is effective in terms of reducing cavities and improving oral health, and safe.
Some would say that there is an absence of clinical identification or divulging of absolute clinical facts that it does not hurt. I mean, when you have people like Dr. Sushila, whom I have great respect for, has excellent credentials, a different perspective in that the fluoride is in the water naturally in India and they're removing it. I get that, but what does Canada and Ontario and Peel base their clinical opinion on?
So as I said, 70 years of research and evidence on and practice actually demonstrating the safety of community water fluoridation. But let's talk about other situations. Let's talk about other examples. You're talking about places, Dr. Sushila mentioned places, in fact, in her home country, where the naturally occurring level of fluoride in their water is in fact quite high.
Yes, it's dangerous high.
Yes, indeed it is.
Toxic almost.
Indeed. In some places in India, it's as high as 48 parts per million. That's almost 70 times higher, 70 times higher than the level that we have here in Peel. The level that we adjust the fluoridation to in Peel is, again, through years of research and practice, demonstrated to be effective and safe. So there are issues with high levels of fluoride, right? Those do cause, we do know that there are health problems associated with levels that are exceedingly high. And in those kinds of places, public health officials such as myself should advocate and do advocate that those levels are lowered to a safe level, such as what we have here in Peel.
So
That's
some of the
exactly
concerned
what's happening.
citizens say that there is no funding for extended research of the potential effects or non-effects of fluoridation of water, what those barriers are. That's too much, that's just fun, that's not enough. There's been no funding of research with respect to identifying that.
Yeah, so I can tell you that, look, at Peel Public Health...
I'm just asking the
No,
question.
I
we have to ask what's the purpose of this, right?
Absolutely, I completely hear you. But here's what happens. You know, at Peel Public Health, we're concerned about the health of our citizens. That's our sole job. So we actually take this issue extremely seriously. We look into all the research that's been done. And what I can tell you is that Health Canada actually sets the limits, whether it's maximum allowable concentration of fluoride, and also what's the optimal level of fluoride so that you maximize the benefits of community water fluoridation. When we looked at the research and what Health Canada did in order to support their recommendations, there are over 430 studies that were referred to in Health Canada's document that supports the levels of fluoride as they're practiced.
So Health Canada supports you, the Mayor of Brampton supports you, the Mayor of Mississauga supports you.
World Health Organization,
everybody,
countless international and national organizations.
Dr. Eileen Davila is here. We have one more segment, and when we come back, we're going to talk a little bit more about the fluoridation of your water in Peel. My name is Michael Charbon. You're watching Brampton Focus. Back after this. Welcome back to Brampton Focus, our final segment. We're here with the medical health officer for the region of Peel, Miss Eileen Davila. She's a doctor, by the way, and we were talking about fluoridation of water. I just wanted to sum up that discussion, if I could, Dr. Davila. How would you put the people at Peel at ease in letting them know that what's happening with the fluoridation of water is positive, they are being duly protected, and that they shouldn't have any concerns? And if they do have any concerns, how would you have them direct their concerns?
So with respect to concerns, right? First, I would tell them that, look, as I mentioned before, as a public health department, our whole purpose is to actually protect and promote the health status of our population. That's really what we're here to do. So every decision we take and every piece of advice we give is with that in mind. We have no other reason to be here. So we have actually looked, and we do continue to look at all the research and study that's done on this issue. We make sure that we study only and really put the emphasis on those studies that are actually relevant to what's happening in Peel, because you'll see lots of literature that actually describes circumstances that are nothing like what we have in Peel. And that's not a good place to make our, that's not a good basis to make our decision. So someone who still has a concern,
even after your reassuring dissertation, which I respect and I believe, what would you tell them to do?
So I would tell them to, one, have a look at the information that we've provided with respect to community water fluoridation. We have looked at all the research, and over 70 years of research and practice demonstrate that community water fluoridation, as it's practiced here in Peel, is safe and effective. I would also encourage people who have a little bit of, skepticism to look at the studies that they're looking at, because presumably they're coming up with this sort of skeptical point of view by reading certain materials.
Well, they do bring documentation. They bring their representation of hard facts too.
So I would actually encourage people to look very carefully at the information that they're studying. Is it actually of high quality? This is not easy to do, to determine how good is the quality of this research. Are the methods actually done well?
Well, every time you have a doctor's opinion, you always ask for a second opinion, right? Another perspective.
Well, as it turns out, though, on this particular issue, remember, countless of international and national organizations, medical and dental in nature, all the way from the WHO to the various Canadian Medical Association, Canadian Dental Association, and these are just a few of the biggies. There are countless others, all agree that community water fluoridation as practiced here in Peel is safe and effective.
So we encourage you to look, research, and ask questions. But I think the definitive answer here from Dr. Davila is that things are cool. I want to pivot to another subject. I mean, you're the medical officer of health for the region of Peel. That is an encompassing, you're also a doctor, it's an encompassing title. Now as we cascade into fall and winter season, the flu shot comes up. How important is a flu shot? Some people are saying that I've never got the flu shot, I don't want to get sick because of the shot, and others are saying because of their senior age, it's vitally important for them to take a flu shot.
So with respect to the flu shot, let's first talk about the flu, right? Influenza is not just a bad cold, right? It is actually a significant viral illness and it knocks people out. Yeah. When you actually get the flu, you are wiped out. It is a very unpleasant
Coming out
illness.
both ends, you have fever, everything's deteriorated,
Absolutely.
And when you're old,
muscle aches,
older.
Yes, absolutely. So here's the issue with that, right? We want to do the best we can to prevent such illnesses from, impacting on us or our families. I think that's
Well, it's a form of
reasonable.
Influenza, right?
Right, influenza
and it's
is what
airborne as well as topical.
Well, the issue is that it is transmitted by other people who are sick, and yes, you can pick it up from surfaces for sure. So here's the issue though, right? It's not just something that can knock you out for a few days. It actually also causes significant, illness that can take people to hospital. Mm-hmm. And yes, in this province, there are at least a few hundred deaths every single year.
Does it cost to get the flu shot?
Influenza. Well, the flu shot is available in Ontario, free of charge. You can get it at your pharmacy, local public health also provides some clinics. You can get it through your family physician.
You encourage people to Peel to
I think the flu shot is a good way to prevent flu. So is hand washing, so is staying away from people when they're sick. But the flu shot is particularly important for those who are at higher risk. So older individuals.
Senior and our golden age folks.
People who've got chronic diseases, right? That especially lung
autoimmune,
diseases.
etc. Okay, let me pivot to our next one because I only got about 2 minutes left and I want to get this one in. There is an epidemic in the Peel region.
There is.
It is, first of all, having people eat healthy, having people exercise, and that all wraps around diabetes. And you have a message for the folks in Brampton and in the region of Peel to be alerted to this because it is of epidemic proportion.
That's right. So if I can, you're absolutely right. It's with a bit of a heavy heart, if I can say that Brampton is, I have to say, Brampton is the diabetes capital of Ontario. We have the highest rates in this province.
Of juvenile diabetes as well?
We're talking diabetes population writ large, and it's largely adult onset diabetes. Well, the problems with diabetes are, again,
contributing factors,
poor eating habits, lack of physical activity. There is absolutely a genetic component there too. So for those of us who are
just being plain solidly overweight and inactive.
I said not eating properly, which and being inactive combines to obesity, and that actually promotes diabetes. And for our South Asian population, they're genetically predisposed towards diabetes and get more complications from diabetes.
So I've got about a minute left. I want to give you an opportunity to speak to the folks directly. What message would you, we've covered a bunch of topics here at the end. What message would you have for our folks at home from a healthy standpoint as you being the medical officer?
Well, so what I would say to folks at home is that, it is vitally important early in life to actually eat healthy and to be physically active. And we're not necessarily talking about going to the gym or doing organized sports. Those are good too, but they're not realistic for most people. I'm talking about walking to the store, taking public transit. So from a public health point of view, what we're trying to do is help construct the community in a way that is more health promoting.
Dr. Irene Davila, who is the Medical Officer of Health for the region of Peel. You've been watching Brampton Focus. My name is Michael Charbon. Thanks for watching. We'll see you again soon.